While we're getting ready for the final lap, just a quick story. I was telling my father a few months ago that I'd moved jobs to the integrated care program for older persons, so that didn't quite make sense to him in terms of what I was doing. And he went to the GP recently, and the GP said, "Tell me, what's PJ doing these days?" And he said, "I'm not really sure, but he's doing something with older people." And my father, the GP said, "Well, how's that going?" "Well," says my dad, "he hasn't been to see his mother for 2 weeks." To which the GP replied, "So it's not a great start then." So I think we're ready to finish off. I'll call on Nick Goodwin, who is the CEO of the International Foundation for Integrated Care, who's going to give a short presentation on the work of the Integrated Care Foundation and tee up a major international conference that's happening in Dublin in May of 2017. So we give a warm welcome to Nick Goodwin, who is in the midst of conversation. Okay, we're ready, Nick, whenever you are. So, Nick Goodwin.
Thank you very much indeed, and thank you for inviting me to your conference. I was here a year ago at the first one, and really interested in particular to read through all of the different poster papers that you had out the back and all of the interesting work that's going on. I've been asked to talk about where Ireland kind of fits within the global scheme of direction in terms of people-centered and integrated care. And it really is, I have to stress to you that this movement in this direction has really become a global theme, to the point that at our conference in Barcelona earlier this year, we had the Director General of the World Health Organization, Margaret Chan, present to the audience on a new global framework for integrated people-centered health services that they had ratified across all of the 192 member states of the WHO. And it's really quite innovative for the WHO to think beyond health systems and start to think about how do we better engage and empower people in their own care, as well as to think across beyond health systems to other sectors in order to support that to happen. And they came up within their framework with 5 key strategies for making that happen, many of which are at a system scale in terms of governance and coordination and so on. But actually the key one, and the one that I think most of the member states, indeed most of the professionals and non-governmental organizations, patient representative groups that were engaged in the process of developing this framework, were really interested in theme 1. And I think that's come through very clearly today in every presentation, that you can't really have integrated care unless it is clearly focused on the needs of patients and service users. Now, it's very interesting before the break to listen to our patient representatives and their view of what this might mean. But I think on the one hand, it's certainly important that we have a new and different therapeutic relationship with our patients that includes all of those issues of compassion and of being ability to listen and being ability to share. But I think what comes through the WHO framework, and indeed most of the other evidence around integrated care, is that our engagement and empowerment of people needs to go beyond that type of ability to talk effectively with our patients, to actually include them in decision-making, to empower them to self-care, to enable them to better manage their medications, to be able to support them to feel safe in the environment in which they live, so that they recognize who to turn to in a time of crisis, and they feel secure in their ability to understand the next course of their illness in a way that enables them to be empowered to manage their own illness and indeed their families or the communities in which they belong to feel empowered to be part of that process. And that actually is a more fundamental proposition that goes beyond maybe what a patient might want, which is being listened to and being treated with compassion and dignity, which is really important, to actually developing a new type of compact between professionals, patients and carers and service users, which really begins to challenge them in a different way to actually become experts in their own care and to support them to do so. Because that, in the environment of older people with complex comorbidities or indeed mental health and all of these issues, is a really important criteria. So I just wanted to stress that because it comes through really very clearly in this integrated movement. So if it's a global agenda for the WHO, it's also a European agenda, both through the European Commission and here as well with the WHO on the European Framework for Action on integrated health service delivery. And again, there's a link here. They've just brought out a number of really excellent resources that describe how we can improve the capacity and capability within our health systems to be able to deliver coordinated services to support and empower people and populations, but also to think through what does that mean in terms of a system level, in terms of the politics or the funding or the accountability that allows us to see alignment from the top that enables the organizations and professionals to work together more readily, that therefore creates a new form of care model that benefits and works around patients and service users, so that the transformational effect of integrated care is really felt at the front line, so that we're beginning to deal and support with people differently than we had done previously, because our care is built up through more siloed-based working. So again, another resource that you should go to. And I could go on, I only have a few minutes, but if you look at almost every government across Europe, integrated care has become a policy priority, either within countries or within regions. And in the purple box, you see a number of examples there. And the focus of the reforms have been around changing the finances, so the financial incentives can embed different ways of working on the ground, or it's about legislative reforms, such as in Scotland, that actually mandates for new health and social care partnerships to support older people's care, or in the Basque Country, where they've said, actually, we're only going to be able to do this if we have integrated care organizations where primary and community and hospital care are all part of the same delivery system. A big issue, too, in terms of funding new pilot programs, trying to find out what works to the patient groups and cohorts that really need greater support within the community. So particularly older people and comorbidities, but looking at different cohorts of the more vulnerable populations within society as well. And the only criticism I always have of a lot of these reforms is quite a lot of the time integrated care at a policy level misses the focus on people, and it focuses on cost containment. And that's the wrong way around to think about it, because we know that integrated care schemes on the ground are much more effective if you think of them as quality improvement programs than thinking they can in some way provide an ability to maintain good care but at lower cost. So getting the head around the argument for why integrated care is important needs to be based on that issue of quality and not necessarily on cost containment. And that's partly because if it is about cost containment, then that will be the game. It will be about reducing emergency admissions, not necessarily about improving the care for older people across a pathway that supports them into hospital and out again. And that can change the way the professionals work on the ground. But everybody's up to it, and everyone's doing different things. The United States is just full. Here we are in the United States and Canada. Just a whole range of different types of innovations, from primary care medical homes, accountable care organizations, new very interesting integrated delivery models in places like Alaska or Massachusetts, really good and effective programs for the elderly, looking after both Medicare and Medicaid patients, so the older patient and also the poorer patient at the same time. And then you can go to the Asia Pacific as well, and you see integrated health and social care teams emerging across Japan in order to be able to support people who are in need of both healthcare but also long-term care in those communities. In Singapore, trying to regionalize the system so that what is very much a hospital-dominated system begins to work together with a growth of strength within primary care and also in long-term care. New Zealand, very interestingly, focusing on families, focusing on how we can get better value for working together within a community. So moving away from the idea that health can be generated through primary, community, and secondary care, but thinking through, well, how can it be created through families and schools, and industry, and other partners within the community that can actually promote health and well-being in a public health viewpoint, a different view of integrated care entirely. And the underlying rationale for all of this, and indeed the underlying rationale for why it's going to be critically important for Ireland to embrace integrated care as one of the underlying concepts going forward, is that no matter how you look at it, care systems as they're currently designed are failing to cope with the increasing levels of complexity that need to be managed within a community, whether that be patients with dementia or people in older age with complex comorbidities, children with complex needs, the issue of physical and mental health coming together, which is always quite poorly done in most places. And because of this failure to bring things together, the systems are, the different parts of the system lack ownership of the holistic problem that patients and carers face. We don't involve the patients and carers as well as we should do. There's poor communication between the different providers in care. It lacks a holistic focus. You treat one element of the problem rather than the whole. And as a result of that, we end up with outcomes that are not as good as they should be. Now, Anya mentioned the quadruple aim. I'm clearly out of touch. I've got a slide on the triple aim, but the quadruple aim is much the same. This is the hypothesis behind integrated care. Where it is done well, and there's enough evidence to demonstrate it, one can improve the user's experience of care. One can certainly improve care outcomes, both in terms of the more appropriate utilization of scarce resources, whether that's in hospital or primary care or nursing home settings or elsewhere, and indeed improving the health of people and populations, supporting healthier living into older age, people more able to manage their conditions more effectively, greater independence in the home, all of which, over time, can build up to some very significant results indeed in terms of the sustainability of care systems. And linked to that sustainability, although there is less evidence for this, but it's growing in some places, is this should also be cost effective as well. It should also lead to a better use of resources, be better value for money. And a complex slide, but it's a long-term process. 90% of this issue is relational. It's to do with cultures, it's to do with people, it's to do with the relationship between the professionals working in teams, the relationships between those teams and patients, how the organizations work together, how the politicians might be able to work together to come to a common view. So a lot of what it takes to make integrated care succeed at the level of the interface between the care professional and the patient requires some careful planning and forethought, the ability to build social capital, the ability to bring people together in order to have a guiding coalition, a clear vision for what it is that you want to achieve, and clear plans that can enable that to happen, with the end point that not only do all of the different care professionals and providers recognize that part of their role is to give of themselves to work with others to achieve a better outcome for people, but actually they have a mutual gain in so doing. Their own organization or themselves, are growing in their professionality, or it enables a better return on the investment of their resources. And far too often when you get into the integrated care agenda, it's who's in control, who has what power, who's owning what money, who gets what staff. But actually, if you can have those conversations at an early stage, it is quite possible to turn that round and recognize that every player has something to gain within the integrated care enterprise on the basis, the fundamental basis, that this will improve care outcomes for people at the end. So the issue here for the planners and the issue here for people is to actually engage with patients and communities, engage with the providers, engage with professionals, so that it becomes really very clear the strategies that need to be taken from the bottom up. to make integrated care happen. So I hope that gives you an understanding that integrated care is a global concept, and in every country of the world there is a different flavour, quite naturally, to what that integrated care looks like. And the approach will look different in Spain, to the UK, to Australia, for obvious reasons, and it will look different here. So there's only so far you can get with evidence, there's only so far you can get with a whole range of different information around care pathways. What's really important is to take that evidence and be able to adapt it to the local context of the communities that you serve, because what matters is what works. And part of the process of integrated care is to take that journey with your community and with your providers to find a different way of working that can lead to better results and better value for money. And really that's the task. So there's not something I can take off the shelf and present to you and say, this is what you should be doing in Cork or Kerry or Valencia. It doesn't quite work like that. But there's enough evidence to give you encouragement to say, if we go down this route together, we should be able to create better outcomes. So I have 2 minutes left. Just enough time for me to welcome you all to, in next May, between the 8th and the 10th, we'll be hosting with the Health Service Executive our 17th International Conference on Integrated Care, with the title of Building a Platform for Integrated Care, Delivering Change that Matters to People. We have opened the abstract process this morning, and also the registrations are also open, and we're seeking to beat Barcelona in terms of our delegate numbers, so we're hoping for 1,200 people across 3 days, something like 500 different oral and poster presentations. Dinner will actually be held, the gala dinner actually held in this hall, and the actual event will be held at the University College Dublin. So we're really looking forward to celebrating integrated care here and supporting Anya and colleagues and all of you who think integrated care is the way forward to demonstrate what you're doing, very much as you've done here today in the posters, to continue to build a movement in the direction to promote integrated care. And this begins not in May. Actually, on Thursday, we have our first webinar series, which you can sign up for. It's all free. And then you can begin to listen to some of the debates around integrated care as a pre-series to the conference itself. And we have a number of different themes. So you can go online and look at the website and have a look across these themes. So some of it is about promoting the health and welfare of people, families, and communities, looking at timely transitions, particularly care transitions out of hospital to home, but really optimizing patient flow, if you like, between care settings. Looking at the management of chronic disease, particularly in the light of how we engage and empower people more effectively. And around implementation. That was my last slide on the main presentation. How do we implement integrated care in a way that is successful? So the call for papers is open, and they're open until Friday, the 2nd of December. Register now is €100 off tickets. We have a flash sale. So we're really looking forward to coming to Ireland. It was wonderfully enthusiastic welcome we've had from Anya and her team to come here to celebrate integrated care with you, so we're really looking forward to it. So, PJ.
Thank you, Nick. Thanks very much, Nick. I'll just call on Valerie and Anya. Anya's going to do a closing address, so we're almost there. Valerie and Nick are going to present a prize for the best poster. I'm wondering, Valerie, if the Late Late Show rules apply. If somebody isn't here, they don't get to get the car?
I bring it home and put it on my show.
Okay, I'll hand over to you.
Well, we had the chance of going through about 56 different posters, and it was really interesting, just the range of the different activity that's going across. And I was really quite struck just how many of the posters were focusing on training, on staff motivation, on listening to patients, and on building that kind of integrated care activity from that level, as well as seeing some really interesting variations on a theme around older people or mental health. But I think we've given a prize to one that kind of hits all of those different themes, and Valerie is going to announce who the winner is.
Okay. So I do hope that the winner is in the audience, because otherwise I will bring that home and put it on my mantelpiece. So Nick and I, as he said, we enjoyed reading all of the posters, and I have to say it's amazing to see not just the bottom-up working, but the top meeting the bottom up, the top down meeting the bottom up, and a lot of wonderful initiatives going on. The one we've chosen, we felt, really did embrace the whole idea of supporting the individual as a citizen with healthcare and social care needs. So without further ado, and I hope they're in the audience, I would like to announce that the winner of the poster prize for this year goes to Successful Application of a Cross-Sectoral Integrated Care Approach to Addiction and Homeless Services, the Experience from HSE South. And that is by Joe Kirby, Dr. Aileen Kitching, David Lane, Aileen O'Connor, Francis Russell, and Rebecca Lockery. If we have anybody in the audience. Anybody here? Yeah, we have a winner. And you are?
Thank you. Thank you, Joe Kirby.
Joe Kirby.
How are you? Thank you very much.
And congratulations.
Thanks very much.
Excellent poster.
Thank you.
Well done.
Thanks. Cheers, thank you. Thanks very much. Thanks a million. Thanks for having me.
Great to get our photograph.
Thank you. Thank you very much.
Should we sit down?
So it's, where has the day gone? That has got to be one of the fastest days ever. That I just can't believe that I'm now closing. That's just unbelievable. What I'd like to do is to try, in whatever way I can, is to summarise what we've experienced here today. And between the posters and the parallel sessions and the speakers, there are multiple examples of innovation and improvement across boundaries, and I think you'll have seen so many different examples of interagency working. But also from a graffiti wall point of view, what I'm hoping is that you can see that there's been a lot of input and comments from everybody, and we are listening. Between the posters and the platform presentations, we have covered the whole continuum of care, and also we've covered most of the country. So we've covered peds, adolescents, adults, elderly, we've covered end of life, mental and physical health, well-being and addiction issues. We've covered CHOs, hospital groups, GP practices, community teams, and patients for patient safety. So that's not bad for one day in Kilmainham Hospital. We've covered Cork, Drogheda, Bray, Kerry, Carlow, Kilkenny, Tipperary, and have I missed anywhere? Dublin, of course. Did I miss anywhere? No? But I have to say, I thought that Cork was a bit overly represented. And there was nothing from Northern Ireland. That's just shocking. So if you like, there's no doubt that there's plenty of innovation at the front line. I mean, that is just evident here in bucket loads. And there's a few kind of messages that I'm taking away. We need to be authentic. Don't be afraid. That came out in so many of the speakers' presentations today and in what we've heard. Don't be afraid. Don't be afraid to put your head above the parapet. We do not have to be sheep, so don't be afraid. And you can make a difference. So we've got numerous examples of individuals who have been brave to decide that they want to make a change, that they want to make a difference, and that as individuals or as teams, you have come together, and that is to be applauded. So you can make a difference, and you matter. So each and every person in this room matters. What you do every day matters. So whether you are a healthcare professional, a manager, a patient, a member of an advocacy group, whoever you are, you matter. And your opinion and your involvement matters to us within the National Clinical and Integrated Care programmes. So please get involved. And whether you want to be actively involved or whether you just want to contribute in terms of feeding back through Twitter, through the website or by email, whatever way you want to be involved, we would love to hear from you. So Please get involved for IFIC 17. We would love to see your posters and your presentations for IFIC. I think it's really important that we beat Barcelona. I think Dublin has got to beat Barcelona. So let's all agree that our aim will be more delegates in Barcelona. So, and my final words before I finish are to really thank all the members of the team. My involvement has been very peripheral, and I'm extremely grateful to the team within CSPD, and we've got all the people there. But I'd like specifically to make reference to Wendy and to Tina. And Tina, who's leaving us, which is, we're very, very sorry to lose you, Tina, and thank you so much for your hard work, and I wish you all the very best back home. And of course, but I'd also like to really give a special word of thanks to Pascal and the rest of the team, but also our excellent MC, PJ. Thank you very much, PJ. I'd like to thank all the chairs of the different sessions and to all our speakers today. And thank you for those of you who put posters forward, and also for all the people who spoke on the platform presentations. Thank you to the judges, and thank you to Nick, Fiona and the IFIC team. Your support for myself and the CSPD team as we develop and travel along our integrated care journey is really appreciated, and I'd like to thank you very much indeed. And finally, that just leaves me to thank you all for coming and for participating so wholeheartedly today. But make today just the start of your integrated care journey. Do get involved, and as Dory does, keep swimming. Thank you.